Welcome to the Assessing Capacity, a Guideline for Nurses online education module. This module is based on our practice support tool under the same name and is located on our website in the Professional Practice section. In this module, we will cover the mandate of the college, the definition of capacity, provincial legislation as it relates to assessing capacity. This will include the Personal Directives Act and regulations, capacity assessments under the PDA, the Hospitals Act, as well as the Adult Capacity and Decision-Making Act and regulations. We'll also cover federal legislation related to assessing capacity, which will include the Criminal Code of Canada and Medical Assistance in Dying, otherwise known as MAID, nurses' accountability related to capacity assessment, and we'll wrap up the module with key points regarding assessing capacity. The Nova Scotia College of Nursing mandate is to serve and protect the public interest, preserve the integrity of the nursing profession, and maintain public confidence in the ability of the nursing profession to regulate itself. There are over 16,000 nurses registered with NSCN that provide nursing services to Nova Scotians. This includes licensed practical nurses, registered nurses, and nurse practitioners. What is capacity? Capacity refers to the client's ability to understand information that is relevant to the making of a personal care decision and the ability to appreciate the reasonably foreseeable consequences of a decision or lack of a decision. Capacity may be determined through a basic capacity assessment, or there may be a need for a formal capacity assessment that is completed by a physician. As we proceed through the module, you will learn more about these two types of capacity assessments and the legislation that guides them. There are important aspects about capacity to note as we proceed through this module, including capacity is an essential element of informed consent. A client can provide the informed consent if they understand the information relevant to the service being offered and understand the consequences of a decision or a lack of decision related to the service. Clients are presumed to have capacity to make decisions unless there is information to suggest otherwise. An individual's capacity may vary with time or with the nature of the decision being made. We can see how capacity plays a critical role in our practice as we provide services to clients. When there is an identified need for a formal capacity assessment, we are guided by Nova Scotia legislation that specifies under what circumstances a formal capacity assessment is to be performed, who is authorized to perform a formal capacity assessment, how a formal capacity assessment is performed and reported, and who is authorized to make decisions for an individual when it is determined that they lack capacity. In Nova Scotia, this legislation includes the Personal Directives Act, the Hospitals Act, and the Adult Capacity and Decision-Making Act. In the upcoming slides, we will break down each of these pieces of legislation in greater detail to help us understand how it applies to our practice and the accountabilities we have as nurses. The Personal Directives Act, PDA, allows an individual to make a personal directive outlining instructions about future personal care decisions to be made on their behalf in the event that they lose capacity. The PDA also authorizes the individual to appoint a delegate to make personal care decisions for them should they no longer have capacity to do this for themselves. If an individual has not made a personal directive and has been determined to lack capacity, a statutory decision maker can be appointed. This statutory decision maker is usually the nearest relative who has capacity and is willing to make decisions. When no such relative exists, the public trustee acts as the statutory decision maker. We would refer you to review the Assessing Capacity, a Guideline for Nurses practice tool on our website, and the PDA Act that this module is based upon to learn more about the specifics of what is defined as personal care and health care. As we noted at the beginning of this module, capacity assessments include two types under the Personal Directives Act: a basic capacity assessment for personal care as part of obtaining an individual's consent for a service being offered. This falls within the scope of practice of many healthcare providers. All nurses can perform this type of basic capacity assessment. A formal capacity assessment, outlined in the PDA, can be requested by nurses when they are unable to determine if the client has capacity or if there has been a significant change in client's day-to-day capacity. The PDA only authorizes physicians to complete this type of formal capacity assessment. A formal capacity assessment is required when requested by the delegate, statutory decision maker, nearest relative, healthcare provider, person in charge of a home care service provider, or person in charge of a continuing care home in which the individual resides. Individuals request a reassessment of their capacity if they feel that their status has changed, PDA Section 10.2. There are concerns that the individual who has made a personal directive lacks capacity to make the decision to leave the province, PDA Section 11, or a delegate's capacity needs to be assessed, PDA Section 13A. Let's now discuss how the Hospitals Act authorizes capacity assessments. The Hospitals Act presumes that every adult client in a hospital or a psychiatric facility has the capacity to make all treatment decisions with respect to their health care. It indicates that all individuals admitted to a hospital or a psychiatric facility must consent to receive treatment. It also states that if a client is suspected to lack capacity to make a decision regarding treatment, the Hospitals Act only authorizes a physician to conduct a capacity assessment to determine if a client can consent to treatment while in the hospital. If a client is determined to lack capacity, the Act authorizes who can provide consent to treatment for the client. Under the Hospitals Act, physicians are the only healthcare provider authorized to complete Form A, a declaration of capacity to consent to treatment. Let's now discuss how the Adult Capacity and Decision-Making Act and Regulations authorizes capacity assessments. The Adult Capacity and Decision-Making Act and Regulations apply to adults who may not be able to make some or all decisions for themselves due to temporary or permanent learning disabilities, mental health conditions, brain injuries, or other health issues. According to the ACDMA and regulations, an individual can apply to the court to be appointed as a representative for an adult who has been assessed to lack capacity to make decisions for themselves in one or more areas. A capacity assessment under this legislation is completed by a designated assessor to determine the need to appoint a representative, formerly known as a guardian, to make certain decisions for the individual across the different capacity domains. These domains include, but are not limited to, personal care, finances, living arrangements, and health and leisure activities. It is important to note that capacity assessments under the ACDMA are for a different purpose than capacity assessments performed under the PDA or the Hospitals Act. The ACDMA regulations authorize the following healthcare professionals to conduct a capacity assessment for the specific reason to determine the need to appoint a representative: physicians, psychologists, and other healthcare professionals including RNs and NPs who have completed an additional training through the Public Trustee's Office. RNs and NPs who have completed the additional required training and are designated assessors are authorized to perform a capacity assessment under the ACDMA and regulations for the specific circumstances outlined in the legislation. Let's now discuss how federal legislation authorizes capacity assessments. The Criminal Code of Canada requires that all clients requesting MAID have an assessment to determine if they have capacity to provide informed consent to request and receive this intervention. Under this federal legislation, only NPs and physicians are authorized to complete the capacity assessments required to confirm a client's eligibility for MAID. This table provides a review of the provider roles in assessing capacity. The asterisk in the table indicates where additional education by the Public Trustee's Office is required that authorizes providers to become designated assessors. LPNs, RNs, NPs, and physicians may assess capacity of clients in their ability to make personal care decisions under the Personal Directives Act, PDA. Additionally, RNs and NPs who have completed the additional mandatory education by the Public Trustee's Office and are designated assessors may perform capacity assessments to determine the need for a representative under the Adult Capacity and Decision-Making Act, ACDMA. It is important to note that NPs, along with physicians, are authorized to assess capacity related to requests for MAID. Physicians have the authority to assess for capacity in all circumstances, as you can see here in this table. Nurses are accountable to be familiar with the specific legislation that is applicable to their practice setting, the type of capacity assessment required, who is authorized to complete capacity assessments, and follow employer policies when initiating an assessment of capacity. Key points of this online module are individuals are presumed to have capacity to make decisions unless there is information to suggest otherwise. Physicians are the only healthcare providers authorized to conduct formal capacity assessments under the PDA and the Hospitals Act, and physicians and psychologists are authorized to conduct formal capacity assessments under the ACDMA. Other key points: RNs and NPs who have completed the appropriate education and are designated as capacity assessors are authorized under the ACDMA to perform capacity assessments to determine the need to appoint a representative for an individual. NPs are authorized to complete capacity assessments under MAID legislation to confirm a client's eligibility for MAID, and nurses should be aware of specific legislation that is applicable to their practice setting, the type of capacity assessment required, who are authorized to complete capacity assessments, and follow any specific employer policies related to capacity assessment. Thank you for participating in this online education module. The document, Assessing Capacity, a Guideline for Nurses, used in this module can be found on our website. We encourage you to reach out to the practice team should you have any questions.